So you're going to come in. There's 4 parts. Most people usually start out with a neurological exam when they're coming in. Okay. So you're going to come in. Either I'll be the patient or one of the other instructors. You're going to come in. You're going to introduce yourself. I'm so and so. I'm a paramedic student. I'm here to do a physical exam on you today. Can you tell me your name? Can you tell me what day it is? Can you tell me where what location are you in? You're doing your orientation questions, so you get that taken care of. Okay. Then you're ready to do your cranial nerves. One, of course, smell. We don't do that much. Okay. You could do one. You could do smell by having odors that people are familiar with, but we're not going to do that today. Okay, we're not going to have a bunch of stuff to be able to do that. But you can say one is for olfactory, and that is for smell. And then you can go in. You go for number 2. I want you to. Can you read my name tag, so that you're able to make sure that vision is okay. You're able to take your pen line at that time. You can check your pupil constriction. Right? You can have the patient look straight ahead. You're coming in from the side. You're checking for, help me.
Lateral movement.
Huh?
Field of vision.
Field of vision. Okay, a senior moment. Okay, I can have at 62, I'm allowed a senior moment. There's a couple ways that you could do that. The one that your book describes is the way in which you have the one side covered, and then you're coming in from this way. Okay, that's how it showed it in your book, am I right? And then they have you doing it this way. For the sake of time, when you do the examination, you only have to do it on one side. So, because we know that you would then go ahead and do the other side for that. Okay, so you're checking your field of vision. You got to bless them so you can get your 3, 4, and 6. Have them look straight ahead. Follow the light with your eyes. Over here, up, down. There you go. All righty. You can check conversions like this. You can check the cover test where you cover the eye and then move away so you can see how well everything is. Okay, so that is 3, 4, and 6, right? So then you can come back and you do fine sensation. All right, you can have them close their eyes, open, close again. I want you to wrinkle your forehead. I want you to blow out your cheeks. I want you to smile. I want you to say, I want you to stick out your tongue. Move your tongue around for me. I want you to say, ah. Gag 'em. That's what that's like gag 'em. You can have 8. You're going to have to probably use your fingers and just rub it together and tell them, ask them to say when they no longer hear it. Because watches don't tick anymore. They used to be nice, but they don't do that. You can do your shoulder shrug. Okay. Neck movement. You can have them go this way. That passive. You can have them do it. Okay. And so, how have you done so far?
Through 11.
I think we're pretty well much done it, didn't we?
11.
Okay.
12
Because you got the tongue. Okay, because you got 9, you got 10, and then 12 on the tongue. You're then going to do passive range of motion. This is part neurological and part musculoskeletal. After you do it passively to see how well things move, then you can do it against resistance to check tone. Push, pull, push, pull, step on the gas. I want you to squeeze. Okay, I want you to push against me. I already did that, didn't I? Pull. All right, you're going to check the reflexes. Make sure that you control it. You hold the arm in your hand like so that you've got complete control. You're going to go, hey, that's great. You see that?
Yeah.
It has one. Okay. There's the radius. Okay, there. Bicep.
3 for 3.
Tricep. 3 for 3. We picked the perfect one, didn't we? Wow. 4 for 4. Knee. When you get to the ankle, as I said, you want to control it. So you take the foot and get them to relax, and once you think they're relaxed, then you're going to bring it real tight, and you're going to hit in the back of the Achilles tendon. but she's got a good one. And then you're going to do Babinski. She's great, isn't she? The plantar reflex. The outside of the foot, you come up in one sweep and then toward the inside, just like this, okay? If it's positive, it's not going to take that much in order to do that. You don't have to take a key like they do in the emergency room and make them bleed when you do that in order to get a positive, okay? Stand. Feet close together. Look straight ahead, eyes closed. You have to assure them that they're not going to fall. Romberg. If Romberg is positive, they're going to do this. You have to make sure that they know you're not going to let them fall. Now take a few steps forward. Open your eyes. Take a few steps. Now backward. Sit back down again. Now you're going to check sensation. You're going to have, you can use a pen, you can use whatever. What you want to do primarily is to make sure they can identify a sharp object against a dull, and have them close their eyes and have what is it you're feeling, sharp or dull, as far as sensation is concerned. Okay? After you've done your neurological examination, have we missed anything? I think so. Okay, we're going to go on. We're going to go to the lungs. There's something tolerant. The lungs, you're going to do inspection. Always mention when you're doing your lungs and when you're doing the cardiac examination, the most important thing in examination is the CRTs and making sure everything's okay, right? So you're always going to say that you're checking your CRTs, you're checking the nails, you're checking the lips, you're checking the rate, and you're looking at how easy the chest just rises as far as inspection is concerned. After inspection, you're going to go to palpation. Palpation, you're going to be just inspecting first for tender areas, okay? And then with palpation, you're going to be checking for your primitives using the ball of your hands. You're going to put your hands in the back, and then say 99, 99, 99. Okay, for our exam, that's going to be plenty, because I know that you know what we're doing. Okay? Sorry, guys. After we do that, you're going to go to your percussion. When your percussion, we're wanting to make sure that you're covering all fields and that your technique is good. Okay, so we're looking at technique and making sure that you're covering all fields adequately. So on the back, you can take your hand, bring it laterally like this. With a couple of your fingers, you're going to get one, and you're going to do a systematic coverage of the whole chest. Okay? So you're going to do your percussion. But we're looking at technique and looking at the fact that you're checking all fields with the percussion. You get to the auscultation then. You're going to use your diaphragm with the chest, and you're going to have to take some deep breaths. Out. Again, we're looking to make sure that you're covering all fields. So you go in, out, again. And just in a few places, you want to make sure that you're covering it while she's taking in her deep breaths. After you listen to the chest, then you're going to go back and you're going to check for egophony. You're going to have her say the letter E. And what's it going to sound like if it's positive?
Ray.
That's right. So if you've got a consolidation, concerned about a pneumonia, concerned about possibly a cancer or something, it's going to come out as an A instead of E. So you've got your pulmonary examination. Next, you're going to do your cardiac. Again, the most important thing on your cardiac is to make sure that CRTs are okay. You're going to be inspection. You're going to look at the chest, how the chest is rising, and you're going to check jugular venous distension, which is best done at 45 degrees, but just have them in their head, and you're going to see if you can't visualize the jugular vein being distended. If it is, a lot of times you can milk it down, let go, and you watch it fill. If they're at 45 degrees and they're in the hospital bed, you can do some transillumination, and with your light, you can get it, the shadow of it to show up on the bed and see it rise a little bit. But you're going to check neck vein. You're going to check to see if there's any abnormal rise. You're going to see if visually you can see where the PMI is. Someone very slender or a child may actually be able to see the area. So after you inspect, then you're going to say, I'm going to use the ball of my hand, and I'm going to inspect the chest wall. I'm feeling for what? Thrills. With the palm, because you're covering a large area. So you're for thrills. Also, in reference to the respiratory examination, being able to use that, you could check for subcutaneous emphysema. You would pick that up as well by using the ball. After you've done that, you're going to say, I'm going to find the PMI with my finger pads. And as you know, it's usually in the 4th or 5th intercostal space, and you just, with the finger pads, lightly, and you're palpating for the PMI, point of maximal impulse. After you do that, then you're going to say, I'm going to listen. You're going to say that you're going to listen first with the diaphragm. You're going to listen over the aortic, the pulmonic, the tricuspid, the mitral. There are other areas that you can use. You can also listen over the epigastrium. But for simplicity, those are the 4 areas that we're looking for. Aortic, pulmonic, tricuspid, mitral. First with the diaphragm, high-pitched sounds. Now I'm going to the bell, and I'm listening for low-pitched sounds over the same areas, okay? Remember, I said in the process when you're checking sometimes for bruits, be careful in the neck, because if you have a heart murmur here, you can get radiation of the heart murmur up into the neck veins when you listen to the neck veins. If there's not a murmur there and you hear a whoosh, 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 then you've probably got a bruit, narrowing occlusion of the carotid, okay? So that is the pulmonary examination. After you do that, then the abdomen. You're going to have the patient lie down. And lying down, again, you're first going to just inspect. Inspection. After inspection with the Dom examination, 1 second. Auscultation is always done second. So you're going to say that I'm going to listen to all 4 quadrants for bowel sounds. Okay? Then I'm going to go back and I'm going to listen for bruits over the liver. I'm going to listen over the epigastrium, the spleen, the kidneys or the renal arteries, and I'm going to listen over the femorals. Okay? After you've done your auscultation, then you're ready for you're ready to go further. We're going to percuss all 4 quadrants. When you're percussing someone, you want to make sure that you cover all the area and don't miss. If they have a large organ and you start too high, you could actually start your percussion right on top of the organ rather than below it. So if I'm going to percuss, I'm going to start real low. Use the same technique that you use on the back. And you try to listen and hear for a sound in the percussion. You'd make a mark, you come up high, go low. If it's within about 10 centimeters, you got a normal liver, so that's okay. You're going to percuss the spleen the same way. You can percuss all 4 quadrants if you're going to try to identify any areas of pain. Then after you've percussed, you're going to go back and do light palpation for pain, and then deep palpation. When you get up to the organs with your deep palpation, you're going to say, taking a deep breath, let it out, and when they do, then you can rake up underneath the ribs to try to be able to feel better the liver and the spleen. Okay? Any questions? That's it. But as I said, talk your way through it, because the examiner is trying to mentally check off paper and at the same time